My name is Naoko Sasamoto. I'm a gynecologist and molecular epidemiologist and do research in women's health outcomes, specifically in ovarian cancer and endometriosis.
Hi, I'm Holly Harris. I'm an associate professor in epidemiology, and I study reproductive health across the life course. What do we do? There's a lot of consortia work. And we work with the Ovarian Cancer Cohort Consortium and Ovarian Cancer Association Consortium, so OC3 and OCAC. And so we have multiple projects through them where we work together, and we each have expertise in two different, like the Dove data set is one that I bring, and then you work with NEC, and then we combine to...
Yeah. Yes, so we also work on endometriosis research together using data from this adolescent to adulthood cohort. And I was just thinking, since I started my position at the Hutch, we've kind of started to work together on the WHI data, which is based here.
Yeah, it's super exciting to do that. Yeah. But we probably met on Zoom, some ovarian cancer-related research
and I think
meeting.
Conferences too, right?
We're like a fun ovarian cancer group. So I think we have a really good balance because we have really very complementary backgrounds. So I have a MPH and then an SCD, which is essentially a PhD. So I'm really a traditionally trained reproductive epidemiologist. So really large population-based studies or designing trials, I guess, is my expertise. And then
and I have a clinical background, so I'm an MD, and I also did my MPH and research training and got my PhD. So I kind of view research from a more clinical, from a clinical perspective. But Holly brings in, her epidemiology.
Yeah, I think it's a good balance. You have to have the clinical perspective, and while I did have my short stint in hospital, having that and then bringing with it, but how do we do research in this area and move beyond the individual patient, issues to make a research project that's going to actually...
Right, on a population level.
Yeah.
Well, at the World Congress, we were dancing. That was fun.
Yeah. Was this the one in Scotland?
Yes.
You were dancing?
There were Scottish dancers, and they dragged us out onto the stage. Yeah. We had to do it.
That was crazy.
Yeah, I think we just both, we came from a very serious environment, not necessarily our mentors, but the environment, but we don't take ourselves too seriously. So I think we just figured out, this person can have fun and talk about science.
I mean, she's an amazing scientist. She's, a great achiever, but she also is very open and transparent about, her personal. Her door is always open. I feel comfortable asking very silly questions, personal questions, and she would be there for me.
Naoko has the best energy. You cannot not get excited about research when you're around Naoko. It's every week we meet and she's okay, so I have this new idea. and I got a grant to submit it to. And so I think that energy is contagious. So yeah, it's the best. I need to siphon it into me. Yeah, I mean, it's sort of a, women's health, next generation. We have all these great cohort studies we work on now, but they're aging cohorts, and we actually need new cohorts that capture younger ages so that we can cover the full reproductive lifespan. And so with our collaborators, hopefully we can start that.
I currently have an NIH grant that's aiming to try to understand how and why patients with endometriosis who are diagnosed at a young age develop chronic pain. We have been talking with collaborators at Seattle Children's Hospital and University of Washington OBGYN department to try to launch an observational cohort based in Seattle to recruit patients who are diagnosed with endometriosis and collect lifestyle. Holly has, the epi research expertise, so collect information on their behavioral exposures, and also collect blood samples so that we can look at biomarkers to try to further understand kind of the disease trajectory. So I think that I'm very excited about that.
Prior faculty at Hutch started these amazing studies that Well, as a single person on them, I only have so much bandwidth to do research with these like things that have great biospecimens. And because Naoko is into biomarkers, which isn't my complete area, she can actually leverage these studies that I'm like, shepherding and trying to get people to work on. And so it's like, another person to do research and, go to the freezers and
Together.